Wouldn't it be nice to be able to scan all your organs for cancer with a single blood draw? Well, we are not there yet, but in 2021 we are getting much closer to this idea than ever before. A new category of cancer tests is coming out with the first test of its kind. It is a blood-only test that with a single blood draw can detect 10 times more cancer types than we currently can with the existing scans and scopes. Watch this video to learn about this new test and find all the ways it can benefit your well-being. My name is Vera. I'm a passionate cancer prevention educator, a former marketer of anti-cancer medicines, and a mother of 3. On this channel, Cancer Worry Free, you will find science-based updates without the science language in a bite-sized format. You will learn about best practices in early cancer prevention, advances in cancer screening, and health hacks to help you lower cancer risk for you and your loved ones. In recent years, advances in technology enabled researchers to identify tiny particles of cancer DNA floating in the body liquids such as blood, urine, and saliva. This led to the creation of a new category of tests called liquid biopsy. With the help of these tests, doctors have been able to design more effective treatment plans and monitor for any leftover cancer after a surgery or treatment. But how about liquid biopsy for early cancer detection? The development of liquid biopsy tests for early cancer detection has been slower because the less advanced the cancer, the less evidence of it in the body fluids, and the harder it is to detect it. Researchers have been working very hard to create tests sensitive enough to detect even the lowest concentration of cancer DNA. So far, we've become familiar with single-organ liquid biopsy tests such as the ones for colorectal cancer, but more recently, several tests have been studied for the early detection of cancer in several organs at the same time. Not only do these new tests find multiple cancer types at the same time, but they also find them much earlier than standard tests do and find them in organs that we cannot otherwise screen. In 2021, the first test of this kind will become available in the United States. This test is called Galleri. It is manufactured by a company called Grail, and it will be able to detect more than 50 types of cancer with a single blood draw before noticeable symptoms occur. Watch the rest of this video to find out all the benefits of this test because you deserve all of them. The first benefit is longer life. The Galleri test has the potential to add years to your lifetime. Studies suggest that the annual use of multi-cancer early detection blood tests such as Galleri will reduce the number of cancer diagnoses in advanced stages by half. With the new test, it will now be possible to find many cancers earlier when they be either cured or treated effectively, so they won't be able to grow and spread to other organs in the body. For example, over 90% of people who got diagnosed with early stage colon or breast cancer became cancer survivors. The new Galleri test will be able to turn more cancer patients into cancer survivors than the current screening tests have been able to. Another benefit is visibility. The multi-cancer early detection blood test will give us the tool to find cancer before visible symptoms appear and trace it back to organs that we currently cannot assess for cancer. At this time, there are only 5 cancer types that have screening tests to detect cancer early. These 5 tests find cancer early in only 30% of the new cancer patients every year. What about the other 70%? For them, unfortunately, there have been no screening options available until now. The Galleri blood test will try to close this gap. It will enable our visibility to additional 45 types of cancer that no other test can detect early. Another benefit is confidence. The Gallery test will give us more confidence in its test results than the current screening tests do. In less than 1% of the people tested with Gallery, the test found cancer when there was none. By comparison, over the course of 10 years, this happened to 61% of women undergoing annual mammography, 23% of individuals undergoing regular fecal tests, and 10 to 12% of men undergoing regular prostate cancer testing. Gallery is also highly accurate in determining the specific organ where a cancer signal is coming from. Why is the accuracy of the test so important? When the test is accurate, you are confident that the follow-up screening and treatment are both necessary and appropriate. If you've liked this video so far, click the like button and consider subscribing to this channel to get weekly updates to keep cancer away. Another benefit is clear direction. The new blood test gives you clarity of direction. If the test detects a cancer signal, you would know with certainty which organ it comes from. Therefore, you would know which organ you need to screen more in depth. Let's say that the test detects a cancer signal that corresponds to the lungs. The next step would be for your doctor to order a low-dose CT scan to confirm the extent of cancer development in your lungs. This test empowers the doctors to confidently design a clear plan of action for your further screening and treatment. It is important to remember that the new liquid biopsy test does not replace the standard screening tests. The new blood test for the doctor is what a stat finder would be for a handyman. They both need it to locate the specific place where more work needs to be done. Then, with the other tools in their toolboxes, they can access the place, assess it, and get the job done. Another benefit is safety. The Gallery test, similar to other liquid biopsy tests, is safer than current standard screening tests. With the Gallery screening tests, there is no invasive procedure, there is no risk for perforation or tear, and there is no radiation. For people concerned with the safety or the discomfort of some of the standard screening tests, the Gallery test is a great option. Another benefit of the new test is efficiency. The new Gallery screening test will make early cancer detection way more efficient. Nowadays, you need to schedule 5 appointments to complete 5 different procedures to scan 5 individual organs. With the arrival of the multi-cancer early detection blood tests, you will need to schedule a single appointment to get a single blood draw to detect cancer and trace it back to over 50 different organs. The Gallery test is efficient because it requires little effort on the patient's part, yet it delivers very comprehensive results. The last benefit is peace of mind. Indeed, the new test gives you some peace of mind. For example, colonoscopies need to be repeated every 10 years in low to average risk patients. Do you need to live in suspense for 9 years in between your 2 colonoscopies? Not anymore. With the arrival of the Gallery test, you can complete this test every year to keep a close eye on your colon. This way you can take immediate and effective actions if necessary without any delay. I'm so enthusiastic about this new game-changing test becoming available soon. Yet, I want to caution you that even as accurate and effective as it is, it does not find all the cancers, all the times, in early enough stages. It does find many more and much earlier than the current standard tests. So, while it does not answer all the questions, it certainly leaves fewer questions unanswered. It enables the doctors to treat cancer in more patients successfully. So while we are impatiently waiting for this new test to come out, I want you to know that there is so much about cancer prevention that you can do yourself. Your vigilance about the cancer risk factors in your lifestyle and your commitment to your regular screening tests are two actions that depend entirely on you. In summary, here are the 7 benefits of the new multi-cancer early detection blood test gallery. Longer life associated with earlier diagnosis, visibility to over 50 cancer types, confidence in its accurate results, clear direction to what to do next, safety of administration, efficiency in the execution, and peace of mind in between your standard screening tests. If you would like to know when and how to get access to this test, please check the description below for more information. As soon as this test comes out on the market, I will create another video to give you more useful details on when and how to use it. If you found this video useful, please click the like button, comment below, share the link with your friends, and consider subscribing to this channel to get your weekly updates on cancer prevention and timely screenings.